Welcome to The Explainer. Today we are diving deep into maternal nutrition. Now this is a topic that is absolutely critical not just for your exams, but for the health and safety of every single expectant patient you're ever going to care for. So let's get right into the essential facts you need to know.
Okay, so here's our game plan. First, we'll talk about why this is all so important. Then, we'll get into the key numbers for tracking weight and calories. You're definitely going to want to write these down. After that, we'll cover an essential nutrient guide, tackle some common risks and complications, and finally, we'll wrap up with your specific role as the nurse in managing all of this.
So why do we even care so much about nutrition during pregnancy? Well, because understanding the why behind the rules is absolutely key to educating your patients effectively and, just as important, spotting risks before they become major problems.
Look, poor nutrition has some really serious consequences. We're not talking about minor issues here. We're talking about things like low birth weight, abnormal fetal growth, either too big or too small, and a much higher risk for complications during labor. This is exactly why your assessments and your patient teaching are so incredibly vital.
To help prevent those risks, we've got to track progress. So, this next section is all about the critical numbers that are going to guide your clinical assessments. And yeah, you are definitely going to see these on your exams, so listen up.
The first number to burn into your brain, 25 to 35 pounds. Now, that's the recommended total weight gain for a patient who starts their pregnancy with a normal BMI. Of course, this number gets adjusted if they're underweight or overweight to begin with.
But here's the thing, that weight gain is not a straight line. In the first trimester, the gain is actually pretty minimal. We're talking just 2 to 4 pounds total. The real action starts in the second and third trimesters, where it ramps up to about 1 pound per week. And knowing that pattern makes this next point crystal clear. A big weight gain in that first trimester is a huge red flag. Gaining more than, say, 6 or 7 pounds is not normal, and it's something you absolutely have to report to the provider. It could be a sign that something else is going on. This weight gain pattern, well, it lines up perfectly with a person's energy needs. You know that whole eating for two idea from day one? Yeah, that's a total myth. Caloric needs don't actually increase at all in the first trimester. The real increase starts in the second trimester with about 340 extra calories a day, and then it goes up to around 450 in the third.
All right, now for the real meat of the topic, the specific nutrients, what they do, and what you're going to teach your patients about them. This is where you take all that science and turn it into practical, easy-to-understand advice.
Let's kick things off with folic acid. If you remember one thing from this whole explainer, make it this. Its main job, and you will be tested on this, is preventing neural tube defects. The recommendation is 600 micrograms a day during pregnancy, and your patients can get it from things like leafy greens and fortified breads.
So here's a classic exam-style question for you. What is the primary birth defect that we see with a folic acid deficiency?
You got it. The answer is neural tube defects, like spina bifida. This connection is a super high-yield topic for your exam, so make sure you lock it into your memory.
Now, for iron supplements, it's all about absorption. This slide gives you a really clear do this, don't do that guide for your patient teaching. You always tell patients to take their iron with a source of vitamin C, like orange juice, because it helps the body absorb it. And just as important, tell them not to take it with milk or caffeine, which can actually block absorption.
Okay, let's play out a common scenario you'll see in the clinic. Your patient needs more calcium, but they tell you they just can't stand milk. What's a good alternative you can suggest?
A fantastic answer here is dark green leafy vegetables. They are a powerhouse of calcium for clients who don't do dairy, along with other things like fortified foods.
Okay, so let's shift gears from the ideal guidelines to the messy, real-world challenges. Now we're going to cover some of the risk factors and special conditions that can make a patient's nutritional health a lot more complicated. So when you're doing your patient assessment, you have to screen for these things. You got to think about their age, if they're on a special diet, and always be on the lookout for signs of pica. That's the craving for things that aren't food, like ice or dirt.
Every single one of these requires a specific nursing approach.
I promise you, you are going to hear about nausea and constipation all the time. So here are your go-to first-line interventions. For nausea, you're going to advise small, frequent meals and tell them to stay away from big, fatty meals. For constipation, the magic combo is more fluids, more fiber, and more activity.
Now, maternal PKU is a really serious genetic disorder, and it requires some very strict diet management. To protect the fetus from toxic phenylalanine levels, these patients must follow a low-protein diet. That means avoiding things like meat and dairy, and also aspartame. And a key point here, this diet needs to start before they even get pregnant and continue the whole time.
Okay, so how does all this information actually translate into what you do every day? Well, it all comes down to the nursing process you know and love. Assess, intervene, and evaluate. As the nurse, your role is super proactive. You're going to be the one collecting the data, providing the education, tracking their weight at every single visit, and making those essential referrals to dietitians or programs like WIC when your patient needs extra help.
Part of providing holistic care is knowing what resources are out there. So, can you name the major federal program that helps provide nutrition support for low-income pregnant women and their young children?
That's it. WIC, the Women, Infants, and Children Program. This is such a vital resource, and you should absolutely know about it so you can refer eligible families who need that extra help with food and nutrition education.
Okay, let's wrap this up with a lightning round review of the absolute highest yield facts for your exam. Ready? First trimester weight gain, 2 to 4 pounds. Folic acid, 600 micrograms. Iron, take it with vitamin C. Caffeine, keep it under 300 milligrams a day. The PKU diet, no protein, no aspartame. And WIC is your go-to referral for support. Got it? Good.
So I'll leave you with this question to take with you into your next clinical rotation. This isn't just about memorizing facts. It's about putting them into practice. So think about it. How will you use everything we just talked about to assess your next patient, to figure out their unique needs and barriers, and to provide that amazing, individualized care you're learning to give?